Hello and welcome to the Simply Free Little Talk. Today is Health Matters. I am your host, Free Little, and today I have an amazing individual, Dr. Richard W. Walker Jr., and he is going to share his amazing journey in his career and what he does today and a wonderful life journey. So, without further ado, I want to first thank my sponsors. I got to thank my sponsors before I bring Dr. Walker in. So thanks all the sponsors that contribute and believe in the Simply Free Little Talk. Thank you so much for that. And thank you again for the listening, viewing audience who tunes in faithfully for all the shows. We thank you. But let me bring in Dr. Walker. Let me see if he's ready. Dr. Walker, you're on call on the Simply Free Little Talk.
Hi, how are you?
I'm wonderful, sir. How are you today?
I'm doing very well. Thank you for inviting me.
Yes, it's my pleasure. It's truly my pleasure. You are a retired physician. What was your specialty, sir?
Yes, for 20 years, I practiced obstetrics and gynecology in Clear Lake, Texas. And then I transitioned out of obstetrics and gynecology to what's called functional and environmental medicine. Uh, the latter two specialties, most people are unfamiliar with, but functional medicine is the sort of like the new kid on the block. Um, Unlike traditional medicine is what everyone knows. You go to your doc and you tell them about your aches and pains and your problems and so on. And they look at the symptomatology of what you have and then they'll treat you accordingly. With functional medicine, it raises the question of how did you get here to that point where you're having a problem?
Good.
So it doesn't just address the problem that you've entered with. It addresses how your body, your environment, and all the things that you've done have contributed to where you are today. Now, the reason why that's a fundamental difference is that when you address that from a causality or from the
Yes,
standpoint of causation, there's a
station.
whole lot of things that you can do that you don't do with traditional medicine. Traditional medicine, you write a prescription, you say, here, okay, call me, let me know. Here's an appointment when you're if you have problems, let me know, and we'll go from
Mm-hmm.
there. Functional medicine says, no, we gotta find out how have you affected your genome or your gene pool to
Okay.
behave in a way it shouldn't. And
Wow.
if we understand that, maybe we can start doing things so that your genes in a different environment will behave the way it was originally designed to do. That's
Wow.
functional.
That's functional. And I love
So,
how you explain this. Yes.
yeah, so functional medicine takes you all the way back. We may even ask questions like, what was the circumstances in which your mom was pregnant with you
Wow.
that these circumstances may have affected your mother, but while she was pregnant with you, they also affected you. Can we figure that out?
Can.
Is there anything else that's going on in your life other
Hmm.
than the fact that you have these aches and pains and you have this or that disease where we might be able to change the course of your lifestyle? And if we can do that, maybe you don't need medication.
I love it. I
Or
love it.
maybe we can take you off the medication if
Yeah.
we make these other changes. Okay. So that's what functional medicine is. And secondly, environmental medicine,
Mhm.
especially for people of color, we rarely ever talk about the effects of the environment on our health.
Absolutely.
And
Please
all my
elaborate.
years, and I've got quite a few, how many times does that conversation come up? Unless I
Uh,
bring it up,
uh,
it does not occur. Okay.
wow.
So, why is that significant?
Hmm?
If you look at what has happened in our country and you look for the petrochemical companies, what you'll find is that the petrochemical
Mm.
companies are usually built around communities that had little economic and or
Yes.
political voice. Okay,
Mm.
and the reason for that was
Yeah.
a sound business reason based upon the mindset of the people who wanted to make money. If I go after the
Yes.
population
Totally
that
concur.
has the least voice, if something goes wrong,
Mhm.
nobody's going to listen. Okay.
No one's
We
going to
will have
listen.
a
Wow.
dominant voice over what the community might say. And therefore,
Mm.
we'll always be in a position of power, political, economic. Okay. And so, not only that, we have a workforce that is in significant need of what we have to offer in terms of jobs. So if something comes up, you're not going to verbalize your concern because I'm your employer.
Mm.
All right. But at the same
Understood.
time, I am going to do what I do in terms of building my company. I have no regard about what the safety is for the
Wow.
drinking water, for the soil, for the food,
Yes.
for the atmosphere, for anything. And then basically, what I have a free hand in polluting your community with
Uh,
no uh, anticipation of repercussions.
uh,
So
not
a
at all.
lot of people have all kinds of diseases that are environmentally induced that
True.
contributes to the functional medicine component that no one challenges.
That no one
That's why I
challenges.
did those
Mm.
two. I'm sorry I took so
So,
long to explain it.
absolutely perfect. You explained it in great detail for us to understand better. And I totally concur with everything that you stated, not in the depths or the knowledgeable base that you are speaking in, but just to hear what you stated, it brought me to the thoughts of communities where people, the entire community ends up with a rare form of cancer, or there are people who live near refineries and the people developed the mothers that have babies, the babies have more defects. It's just so many stories that we've heard, but as you stated, and you clearly made it clear, no one challenges these things. So let's talk about you being the CEO of Walker Healthcare Holdings. Is this what you guys do there, or is that at TVP Care, or both?
Well, well,
A lot of
you probably can tell already that I'm sort of a rebel at heart. I was in traditional medicine,
yeah,
but at the same time, I got out of traditional medicine because I didn't like what I found.
yes.
Walker Healthcare Holdings and TVP Care. Walker Healthcare Holdings is the parent company.
Mhm.
TVP Care is the brand name in the marketplace, but it is also a wholly owned subsidiary of Walker Healthcare Holdings. And I'm going to try not to go too much in depth, but the whole basis of the parent company
Okay.
is because of things that happened to my mother. My mother wound up
Oh,
in ICU in a coma for in 2 consecutive years
mm,
for 3 to 5 weeks each I signed off a DNR, do not resuscitate, not expecting her to live, but she did.
Yes.
Um, and then after the first year, they did it the second year. Well, what did they do? They made it so that it was difficult for her to get the kind of care that she need unless she got to the doctor's
Um,
office. Well, what's wrong with that? Well, she was in her 70s at the time and she
mhm.
had severe arthritis. Well, with severe arthritis, there were 7 steps that she had to negotiate in order to get down, to get in the car to go to the doctor's office. Unless she had 2 grandsons come and pick her up and take her to the doctor's office, she couldn't get there. Well, that meant that the 2 grandsons had to take off from work in order to go get her to take her down the 7 steps and then
Mm,
reverse it and do it every month.
mm.
Okay, so you're telling me that you have no capacity
Wow.
to assist a 70, mid 70 year old woman in order for somebody to come to her home knowing that she had severe arthritis and she couldn't
Severe arthritis.
navigate the steps to get to you. Well, that's a
Wow.
failure of the system.
Yes.
And it caused her to be in a coma for 3 to 4 weeks with an 8-week rehab in another facility. And then you
Mm,
did it twice. So
twice.
if I take that information about
Hmm.
one woman and
Yes.
multiply it by
Yeah.
70 million,
Yes. Yes.
you're
Say
now
that.
telling me that you're doing the right thing for 70 million people who have chronic diseases, who are people,
Wow.
mainly people of color, and that you can't do better than this.
My Lord.
I can do, I can do better
Mm,
than what you're giving her. Thus, the
mm.
formation of my company, it took 17 years for me to get it to the point where I had all the technology, all the tools, all the things that I needed, all the training. I went back to school, got an MBA. Then I found out that the MBA wasn't enough. So then I had to go to another type of school called an
Mm.
accelerator. An
Yeah.
accelerator is a school that
Wow.
specializes in entrepreneurs becoming successful entrepreneurs. And then recently,
Yeah.
last week, because of what's happening in healthcare, I wound up.
Mm.
I mean, at my age, and I won't tell you how old I am, but
Wow.
I'm pretty close to 100. But at my age, um, I am. I found myself taking more exams, and I had to produce a thesis last week, which was accepted and approved and passed,
Good.
which gave me certification in the new medicine that is occurring in the
Yes.
United States that most people don't know
Mm.
about. It's called
Yes.
value-based care.
Value-based care.
Value-based care. Now, value-based care is going to replace what's called
Y'all
fee for
listen for
service.
that.
Okay, what fee for service
Yes.
is you go to the doc, you pay your copay or
Yes.
whatever.
Okay.
You and the payer, either
Hmm.
Medicare, Medicaid, Aetna,
Yes.
Humana, you're responsible. But the new healthcare business model says, I'm going to make the provider, the doctor, the nurse practitioner, the hospital, the medical
Ooh,
group, whatever, I'm going to make you financially responsible. And if the patient gets
wow.
sick or goes in the hospital, you pay because I'm not paying anymore.
You pay. Whoa.
So the
Oh,
doctor's on the hook,
interesting.
the hospital's on the hook, the medical,
Mm.
they are now on the hook because they have a contract. The contract says that the patient is no longer the one who is going to be on the hook for all the financial
Yes.
responsibility, and the payer, whoever it is, Medicare,
Whoever.
Medicaid,
Yes.
Aetna, Humana, Optum, they're only going to pay you so much. And if the patient gets sick, you don't keep
Wow.
them well, then you are the one who's going to pay their bill.
Interesting information. Very interesting information. Wow. That
So
needs to be noted.
you asked me a question, and it's weaving its way through
It's
whatever.
weaving back. Yes.
But the
Wow.
reason why value-based care is so important is because it's the first time in over 400 years people like us have
Yes.
the opportunity to have equity
Yes.
in healthcare.
Yes.
Prior to this,
Wow.
it wasn't even discussed.
Wasn't even discussed. Yes. Thank you for sharing this information with us. This is very valuable information. This is actually um, kind of relief as well for those that who have chronic illnesses. Now there is some stake in it, you know,
Yes,
and they
absolutely.
want to make sure that they're not going to be held responsible. Yes.
Yeah.
Ah.
Well,
So
if
if
you talk
someone has
about
chronic
chronic disease,
asthma, mhm, yes, speak on chronic
I was
disease.
going to say,
Yes.
if someone has a chronic disease, regardless of what it
Hmm.
is,
Whatever
um,
it is. Yes.
then for the most part, um, you would say, and it would be right to say that the majority of those with chronic diseases
Mhm.
are people of color.
Yes. Unfortunately,
Okay. Well, if you know that, why don't you do something about it?
it's true. Well, I think you're starting in a grand way that we need to know about this. That's why you're here on the show, so we can learn more and know what is our role. Because I'm always a person that likes to wisdom nuggets, but I want to know, what is that process? What does that look like for us, Dr. Walker? What can we do as citizens, as the general public, the patient
Well, that's a very
or
fundamental
patron?
question, and it's an excellent one. And it's the
Thank you.
reason why I wrote my book, Black
He's a
Health
mentor.
Matters. I wrote that last year. You can get it on Amazon. You can get it from the publisher, Square One Publishers.
Yeah.
It's out there in the marketplace. And what the book is all about is, as a people, we have to
Mm-hmm.
stop waiting for somebody else to take charge of what is our responsibility.
Ooh, that's a good one. That's a good one right there.
Okay.
That's a good one.
You
Yes.
can't say anymore it was because of the healthcare system. No, I wrote a book
Yes.
that talks about all the chronic diseases and all the things you can do in order
Um,
to mitigate the severity of the disease. So you no longer have excuses to say it wasn't my fault. Yes, it is. Okay.
mm,
You can no longer say
wow.
that it is genetic. Chronic hypertension, renal failure, type 2
Yes.
diabetes,
Mm,
stroke, heart attack, none of those,
wow.
well, let me not say be so absolute. The
Yes.
majority of those are not genetic.
Mm. Y'all hear this? This is wisdom speaking. Yes. Medical wisdom and faith.
And when I say they're environmental, what do I mean? That
Yes.
means they occur because of what you eat,
Yes.
the fact that you don't exercise,
Uh,
the fact that you're not doing the things that you know you need to do.
mm,
Put the Burger King and the McDonald's down. Stop drinking all
right.
those sodas. If you have type 2 diabetes,
Mm,
lose weight, take your medication. If you have hypertension,
mm,
hypertension is a what they call the silent disease. That means you're
mhm.
not going to feel any symptoms until it's too late.
Wow.
Okay, so Dr. Walker, are you telling me that I need to take my medication all the time?
Mm.
Duh.
I think that's why it was prescribed.
You got to take the medication all the time because it is a
Yes.
symptomless condition. Now, when do
Wow.
you get symptoms from hypertension? You get symptoms when you're
Mm-hmm.
about to have a stroke or you have a heart attack. Those are symptoms. 7 out of 10 people who have a heart attack die on the first heart attack.
Mm. The first heart
Okay.
attack. Wow.
So, the time for excuses for us as the people, come on, we ain't
Um,
buying it anymore. I did
mm,
my work
you did
so
the
that
research.
God said,
Ah,
you write a book and you put it out there,
ah,
and the burden of
yes.
responsibility is no longer mine. I wrote the book.
You, ah, you wrote the book.
God is
Can you give us that
holding
title
you
once again?
accountable.
Yes,
Say that
yes.
again.
We're responsible. Please
You're
say the name
responsible.
of the book, the title of your book. You're
Black
responsible.
Health Matters. Black Health Matters. You can get it on
Black
Amazon
Health
by
Matters.
Richard W. Walker Jr. You can get it from the publisher, Square One Publishers.
Love it.
Black Health Matters. The book I wrote before
Wow.
that is,
Yes.
I'm blocking on the name of that. And then I got a new book that's coming out next week, I think.
Okay.
And that book is called What's Wrong with My Child? And it's about children and parents, families that have kids with behavioral issues, ADD,
Yeah.
ADHD,
Yes.
and so on.
Oh,
And
this is
what
good.
do I do about it? How do I get some answers? And it goes into what you can do without medication, how to look
Mm,
for it, and then how to
yes.
look for the doctor, the right doctor, to take care of you.
The right doctor.
So that's coming out.
Mm, I love it. I love the books that you have. Black Health Matters. What's Wrong with My Child? That right there is something you want to purchase as even a grandmother. You know, wow. You want to make sure that you're getting the information that you need and making it applicable to your life. You spoke of that.
Yes,
What are we doing? We're responsible. So, burden of proof is on us now. We got to do it. We got to take care of
it's
our
on you.
business.
It's
It's
on
on
you.
us. Wow. What is that? What's wrong with my child? So, what inspired you to? I mean, I know it's God that inspired you, but being in the medical field as many years as you have been, what things that you see that we as the community coming in to see you were repeatedly, what things you repeatedly saw? I know it has environment, but you kind of share with us the things because maybe some people don't know.
Well, the main one is the one I just discussed. How we, our history in America is a real history, but we use
It's
the
really
history as an excuse for not
mm,
changing behavior to do
mm,
what we're supposed to do. It's always
yes,
about the history. There's a scripture in the Bible that says, any man who puts his hands to the plow and looks back is not fit for the kingdom of God. In other words, stop
mm,
driving your car by looking in the rearview mirror.
that's
And
good.
that's what we do.
That's some serious
We
one.
drive the car, but we're looking in the rearview mirror. Well, no, look at the
Mm,
windshield. Look in front of you.
yeah.
And so, as a people,
Wow.
and I know a lot of people may not like to say, well, Dr. Walker, what about the Black history? I know about the Black history, but Black history isn't my future. It's history.
Mm, that's what it is. It's history, and we need to go forward and be progressive and take
Yeah,
responsibility.
absolutely. I hear some
Whoa.
people getting mad at me.
You hear them through the
Yeah,
screen. I
they get
love it.
mad at me. Okay, somebody just
Oh.
threw a tomato. Well, you missed with your tomato. So, okay, I'm ducking, but that's okay. All right, you
I
still
love
missed.
it. I thank you once again for coming on the show today. We need to hear the truth. We need to look at self. I'm learning that in this time, in this era that we're in, we do need to look at self, and we have so many corrective measures. You just shared a numerous amount of them of what we can actually do to improve our health, improve even our process of thinking, and look
Yes.
at it from a perspective that you provided for us today. So again, I thank you. Is there any other words of wisdom you want to give us? I love not looking in the rearview mirror. That was a great nugget. We can make that applicable in so many other areas of our life as well, other than health.
Well, one other nugget, and I'll make it short, but it would be a whole program, and that is
Okay.
uh, define your own reality.
Ooh, boom. That's one that's a good one.
De-
That's
define
excellent.
your own reality. You see, God didn't give you a reality that's His because you can't handle it. But too many people
Ah,
try
come
to tell
on.
you what
Come on.
too
That's
many
true.
people try to tell
If
you
you
what
only knew.
their reality for you is. Don't accept their reality. What reality
Yes, often.
is it, do
That's the
you
big
have?
one.
And one of these days,
Mm,
when you invite me, I can
yes.
go into that a little bit more.
I would love that. I would love for you to come back and simply just share on defining your own reality, because that's the pathway, as you and I have previously discussed, that I'm on. I just want to do what God told me to do, but He wants me to define it according to how I walk it out, but walk it out in
Absolutely,
obedience unto Him. So yeah, that's
absolutely.
great. That's great. Yes, I love it. I love it. More people need to hear that, those words of bold nuggets. That's what I call bold nuggets. That's like, hey, I'm not sugarcoating it. It's no sugarcoating at all. This is
Yeah.
boom. This is it. Target. You
And,
launched
and,
the
ju- and
missile then.
yes, and just for those people who think that I may have missed the mark, God
Mm.
is focused. God doesn't play. There was a guy by
Come
the
on.
name of there's a guy by the name of Moshe. We call him Moses. And if you look at Moshe's life,
Yeah.
you
Yes.
know,
Yes.
Moshe was
Yes.
revered.
Moses, yes. Come
Okay,
on.
but
Teach
did
us.
he get into the promised land? No,
Uh-uh.
because he was disobedient.
Mm-mm. Say
After
now.
all he did, God asked him to do something, and he was disobedient. And God
Wow.
said, "No, uh-uh. I told
Mm.
you to do this. You did that.
Yeah.
You don't go." So,
You
as
don't
much
know.
as we like to take God for granted, God don't play. You
Mm-hmm.
can tease me, or you can
Mm.
fool, Ms. Little, but
Good. It ain't happening.
listen,
Hmm.
and you
Wow.
can't come back to
Wow.
heaven.
That right there.
Yeah, you
Ooh.
can't come back to
Ah.
heaven with the same tools that you came to earth with.
Mm. Ooh, come on now. You know I love it when you teach on that about being empty. Come on, just say it before we go, please. Share just a nugget, just a little nugget. They need to hear it because I'm excited.
When you get to heaven,
Yes.
you cannot go back to heaven with
Ah,
the same
can't
tools
go
that
back
you
to it.
arrived on earth with. Those tools,
That's so
all
good.
those things were supposed to be left here so that when you arrive back in heaven, you are empty.
Yeah. Oh, thank you. Thank you, Dr. Walker. Okay, everyone. If you have not been blown away, even the one who threw the tomato, Dr. Walker, just do this here. You missed it by an inch. But
Miss
Dr.
me. You
Walker,
got you got to
thank
aim better
you.
than that.
They got aim better. I am so honored that you came on the show. And yes, you will be welcome back. In fact, you have an open invitation, Dr. Walker, because
It's
we
my
need to
pleasure.
hear the truth in this season, especially in this timing, this dispensation. We need to hear the truth. No more
Yes.
emotional feel good messages, no more brimstone and gonna, you want to hell. Tell me how not to go to hell.
Yeah. Yeah.
Okay, I don't
Yeah.
want to get on my
Thank you.
soapbox. I don't want to get on my soapbox. This is health matters.
Yes.
But I just want to see people live a healthy, vibrant life. And so that's why Simply Free Little brings guests on like yourself for health matters and for other spiritual enlightenment, because I want to do my part, because I'm not returning full of potential. I'm going to return back to heaven emptied out. So I
Yeah,
thank you again, Dr.
absolutely.
Walker, for coming on. This is Dr. Richard W. Walker Jr. Please get the book. I love it. Black Health Matters. And I'm really looking forward to the one is What's Wrong with My Child? That's a good one.
Yeah.
But remember what he left with us. He said, define your own reality. I love that. I'm standing right in that place right there where I'm defining my own reality and walking it out in obedience unto God. So we're going to sign off together if that's okay with you, Dr. Walker. We want to tell
Absolutely.
them thank you for tuning in. You have met Dr. Walker. He will be back on Health Matters, and I'm sure you'll see him real soon on Inspirational Monday. I guarantee you will. So thank you for tuning in again.
Thank
I
you.
want to thank the sponsors who contribute to the Simply Free Little Talk. And for the viewing listeners, your faithfulness, I do not take it for granted. I appreciate you. I thank you, and God bless.